All right, Dr. Jenkins here. This is our additional part of the urinary system lab. And in addition to the anatomy, I wanted to talk a little bit about something that maybe was a little bit more practical, something that we could relate to. So we're going to talk about how alcohol affects the urinary system. If you don't drink, you surely know of people in the world who do. And then we're also going to touch on a little bit of fluid balance. Just some application here. So as I said, now that we know the basic anatomy of the urinary system, let's talk about some examples. All right. We're going to begin with some terms. And maybe you know these, maybe you don't. A diuretic, something, and I'm going to use my own words just because I think it makes it easier to understand. Something that makes the body or makes you urinate or pee. We see this a lot of times in healthcare, in the hospital, people with heart failure, something like that. Sometimes we need to give a diuretic. We also have natural diuretics in our body, things that we already have in our body, that when they go to the kidney, the effect of a diuretic is to make you pee more, which means that an antidiuretic is something that makes you pee less. I'm even going to write the word pee, because why not? Or, in other words, if it makes you pee less, an antidiuretic, something that makes the body retain water. So instead of releasing fluid as urine, an antidiuretic makes you retain water. A diuretic makes you release that water or release that fluid as urine. But an antidiuretic, instead of peeing it out, you retain that fluid. So make sure you start with these basic definitions. Okay, so we're going to give some real-life examples of how alcohol affects the body. Let's walk us through it. So you're having a beer. Just an FYI, a beer is mostly water, maybe about 5% alcohol. Some beers have a higher alcohol content, maybe 7%. If you go to Canada, other parts of the world, you may even get a 9% alcohol beer. But it's largely water also, but that's just extra. Let's give some numbers to help us understand this. For every 200 mils of beer that someone drinks, and you can see we're using the metric system instead of ounces, for every 200 mils of beer, when you drink it, a lot of that alcohol is going to go to the liver where it's broken down. And the liver, in addition to producing some CO2 by the body, the liver will produce a very similar amount of water. So it just happens that way. When the liver is metabolizing alcohol, it happens to produce a similar amount of water. May not be the exact same, but for the purposes of our understanding and for this exercise, someone drinks 200 mils of beer, their liver is going to produce 200 mils of water. Okay, that water from the liver is going to go to the kidneys. And what are your kidneys going to do with it? Your kidneys are going to release that, because it's excess, they're going to release that as urine. But here's the thing. With alcohol, we end up excreting more urine. So for an average alcoholic beverage, you're going to urinate an extra 120 mils. So for our example, we drank 200 mils of beer plus the extra 120 mils of water. We're going to release a total of 320 mils of urine. The 200 mils of water from the beer, and then an extra 120 mils of water that happens whenever we have a standard drink of alcohol. The question is, why? The reason is because alcohol is a diuretic. And remember, a diuretic is something that makes you pee more. Alcohol makes you pee more. We just said that, right? We pee more. We drink 200 mils of beer, but we end up peeing out 320 mils of beer. The reason is because alcohol is a diuretic. It's a natural diuretic. I'm going to skip ahead for a minute because what I want to do is I want to talk about this hormone, antidiuretic hormone. ADH, antidiuretic hormone. Let's talk about this hormone. This is a hormone that is released by the pituitary gland. And as we know from our previous anatomy, the pituitary gland is in the brain and it hangs down from the hypothalamus. If we magnify the pituitary gland, we see it has two parts, an anterior pituitary gland and then a posterior pituitary gland. Well, it just so happens that ADH is released from the posterior pituitary gland. We have this natural hormone called antidiuretic hormone that is naturally released from the posterior pituitary gland. Upon its release, this natural hormone, ADH, travels to the kidneys. All right? Let's talk about what this hormone usually does. Antidiuretic hormone, when it's working properly, usually tells the kidney to retain more water or reabsorb more water back into the body. It's an antidiuretic. So instead of releasing pee, antidiuretic hormone tells the kidneys to retain that water back into the body. And you see, the beauty of this is that we know the anatomy. Let's look here. We can actually identify where specifically in the kidney ADH has its action. Come on, let's do some anatomy. It's fun. We remember we have the glomerulus. Coming off the glomerulus, we have the proximal convoluted tubule. It's shown in blue. And the proximal convoluted tubule is going to lead into the nephron loop or the loop of Henle. And then that loop of Henle is going to lead us into the distal convoluted tubule, shown here in a mustard color. You can see bits of it peeking out here. And eventually, the distal convoluted tubule leads into our collecting duct. What a beautiful review of the anatomy of the nephron, right? Love it. Well, what happens, ADH, when it's working properly, ADH goes to the kidney and it goes to the descending limb of the loop of Henle. We didn't talk about the specifics, and that's okay. But just for ease of understanding, I wanted to point it out. This is the descending limb because the fluid is moving down. This is where water moves from the loop of Henle back into the bloodstream. So when ADH is working properly, water is being reabsorbed from the loop of Henle back into the bloodstream. But this is where alcohol comes in. Alcohol is a diuretic because it suppresses the release of ADH. Make sure you know this. Alcohol is considered to be a diuretic because it suppresses antidiuretic hormone. If ADH, didn't mean to do that. Having a rough time of it right now. Like I said, maybe by the end of this course, I'll figure out how to use this thing. If ADH usually goes to the kidneys and tell it to retain water, what happens when ADH is suppressed? Because that's what alcohol does. Alcohol suppresses ADH. So instead of having ADH, maybe I'll use black here. Instead of having ADH to reabsorb water, there isn't as much ADH. So we don't reabsorb water. And when we don't reabsorb water into the bloodstream, that water stays in the tubules. So because we've suppressed ADH, water does not get reabsorbed into the bloodstream, and that water stays in the tubules and eventually gets peed out as urine. I mean, this is pretty cool, folks. Alcohol is a diuretic. How is it a diuretic? Because it suppresses what usually tells the kidneys to retain water. If we suppress what usually retains water, we end up not retaining as much water. And if we don't retain as much water, that means there's more water to pee out. So the effect is a diuretic. And this can have negative effects because it dehydrates the body. This is bad. We want to reabsorb water for a reason, to keep our cells hydrated. But because of alcohol, we don't reabsorb as much water and we release it as urine. And this could dehydrate our body. What a good example, huh? The question is why? And I'm not sure that we have 100% clear idea of why alcohol suppresses ADH. Why does alcohol suppress ADH? As scientists, don't we always want to know why? I mean, I do, you may not. The leading theory right now is that alcohol tends to be a diuretic because it just is an attempt for the body to get rid of that alcohol and its byproducts. Alcohol does affect the body quickly, and our body does prioritize getting rid of that alcohol. So maybe the reason why it's a diuretic is because that helps our body get rid of alcohol and its byproducts. But in the process, it can actually dehydrate the body. Now, there's other ways. So the main way that alcohol is a diuretic is because it suppresses ADH. That's the primary way. But there's also other things. Alcohol tends to stimulate the bladder to contract. So whatever urine is in there, you feel like you have to go to the bathroom more. And let's face it, for those who drink, maybe at times drink too much, you're more likely to lose additional fluid, not only through alcohol being a diuretic at the kidneys, but you also are more likely to lose fluid because of vomiting or diarrhea or even sweating more. We can lose fluid through perspiration. Good stuff. Can we prevent the effect of alcohol being a diuretic? As you can see here, the answer is basically no. We can't change the fact that alcohol suppresses ADH. You can, if someone is drinking alcohol, they can drink water along with the alcohol to maybe lessen the diuretic effect. You can drink alcohol more slowly to give your body more time. Excuse me. But really the net effect is always going to be the same. It's always going to be, to some degree, a diuretic. Now, let's do some math, just as a way to practice. I know you love math. Okay, let's do some math. The normal urine output is 1 to 2 mils of urine per kilogram per hour. That's one way of estimating how much urine a person should release each day. Another way to look at it, another guideline, is the normal urine output is about 60 to 80 milliliters per hour. Let's just do some calculations for fun. And you can see that in this first set of calculations, we are calculating urine output sans alcohol. And if you're not a fan of Latin, sans means without. Okay, so we're going to calculate our urine output without alcohol. I'm going to use my weight as an example, but I want you to go ahead and use your weight as an example, and you're going to be asked to fill this in the lab assignment. So if the normal urine output is 1 to 2 mils per day, per kilogram per hour, I just went right in the middle, so we're going to just estimate using 1.5. So we're going to take 1.5 times our weight in kilograms to get how many mils of urine. In order to do this, you're going to have to convert your weight in pounds into kilograms. So take your weight in pounds, and we divide our weight in pounds by 2.2 to get our weight in kilograms. I'll use my weight just as an example. I know that my weight is about 152 pounds. I know if I divide that by 2.2, I'm about 69 kilograms. But please, for the lab assignment, use your own weight. So whatever your weight is in kilograms, you're going to plug that in here. So I'll do my calculation, but you're going to use yours. So this would be 103.5 mils per hour of urine. Feel free to pause this video if you need to complete the calculations. This is urine output without alcohol. Now, let's go ahead and do it with alcohol. Remember, for every standard drink, we increase our urine output by about 120 milliliters. So I'm going to ask you to calculate how much urine you would produce if you had 2 drinks in an hour. I'll use my example. If I go back, without alcohol, I had 103.5 milliliters of urine. 103.5. So I do 103.5. And then I'm going to add to it the amount of urine produced by alcohol. If I had 2 drinks in that hour, and each drink adds 120 mils, I'm going to add 240 mils. So I do 103.5 plus 240, and I get 343.5 mils of urine. This is with alcohol, and without alcohol, it was 103.5 mils. So proof that alcohol is a diuretic. It's going to make you pee out more. But again, you're going to use your weight for your own calculation. All right, part 2 of this video is I wanted to give some examples of overall fluid balance. This can be useful to people in healthcare, so nurses, doctors are looking at this a lot, but it can also happen in our everyday lives. It can happen. You can get dehydrated, right? So the idea is, how can we manage our fluid balance? Let me just go back here. We want the overall amount of fluid into our body, say through drinking, through eating, because there's water in food. We want our fluid in to equal our fluid out. How do we lose fluid? Urination. Through pooping. There's water in our poop. We may release fluid through vomiting. We may release fluid through sweating. Ideally, these are level. When they're not, a fluid imbalance can occur. I'm going to go through one example with you. It's a case study. And then you are going to do the other two case studies yourself. We're going to input this data into your lab assignment. Not that you would actually be working with the heart failure patient in the hospital, but I think a simple addition and subtraction of these numbers can help us understand the importance of fluid balance. So here we have our first case study. It's someone with heart failure who's in the hospital. Here we're looking at fluid intake. So we're going to basically look at fluid intake, and then we're going to add up fluid output, and we're going to compare and see if there's a difference and an imbalance. Let's add up the fluid intake. This patient brought in 25 mils of fluid per hour. How many hours are we calculating? 8. So I take 25 times 8. We're going to be calculating in milliliters. That is 200 mils. This person also got some nutrition through an IV bag, some fluid with some sugar and electrolytes in it. 80 mils per hour. So I do 80 mils times that same 8 hours. 80 times 8. And I get 640 mils. This person received 1 unit of blood. Blood is mostly water. So I have 250 mils. And then this person also received some vancomycin, which is an antibiotic. But because it's such a potent antibiotic, it has to be given with an IV bag. So that IV bag is an additional 250 mils. So this is how you're going to figure out the next two case studies, okay? Then we're going to add all these up. When I add all these up, I get 1,330 mils of fluid. So now we know our fluid input for the 8-hour shift of this person in the hospital. And these are, by the way, these are pretty reasonable numbers for what someone in the hospital over 8 hours might actually receive. Now we're going to look at the fluid output. So we have the fluid input. Now we're going to calculate the fluid output over those same 8 hours. So that person over 8 hours urinated a total of 500 milliliters. They lost 30 mils of fluid through a chest tube. A chest tube is a needle that goes into the chest to drain fluid. Maybe this person has some fluid around the sac of their heart or some fluid in their chest cavity. That's part of why they're having heart failure. So we want to put a chest tube in and drain that fluid. And what they'll do in a hospital is they'll have that fluid draining into a unit where you can actually, every so often, read how many mils of fluid were connected. And then this person, because they're receiving nutrition through that IV, they may also have an NG tube, a nasogastral tube. So they're actually receiving nutrition through this. They're not able to eat solid food. So we have this tube going down their nose, the back of their throat, into their esophagus and their GI tract. Sounds pleasant, right? Well, just the nature of things being what they are, you're going to collect fluid around that. So we're going to have some leaking fluid. So that nurse or whomever is taking care of this person will take a little suction thingy and they'll remove some of that extra fluid that was lost through this tube. So let's say over that 8-hour shift, that person lost 100 mils of fluid through their NG tube. We add that up, and it is 630 mils of fluid lost, fluid output. So now you are going to compare, and this is what you're going to do with the two examples that you have. We already did the calculations for our case study number 1 example. Their fluid intake was 1,330 mils. Their fluid output was 630 mils. And you're going to subtract the smaller number from the bigger number. And when I subtract this, my net is 710 milliliters. Now I'm going to ask you, which would it be? Would it be that this person is fluid overloaded, or are they dehydrated? Here, the fluid intake, they brought in more than they peed out or they lost. So if they have more in than out, they are fluid overloaded. Common condition with someone with heart failure. If they are fluid overloaded, what might this person need to fix it? I am not going to give you the answer here, but you can certainly figure it out. If our problem is that that person is overloaded with fluid, would they want a diuretic to fix it? Or would they want an anti-diuretic to fix it? You're going to figure that out and put it in your lab assignment sheet. I do want to make a point here. I have given you an example of a common diuretic, Lasix, but I want to give you a little bit more information about these anti-diuretics. Typically, if someone needs an anti-diuretic effect, the most common thing is to give a fluid IV. There are anti-diuretic medications, but they're really not that commonly used because we can get an anti-diuretic effect really well by just giving someone an IV bag of saline fluid. But you're going to put on your answer sheet whether, in order to fix their fluid overload, if they would need a diuretic or something to act as an anti-diuretic. Here is case study number 2. This is going to be a kidney disease patient, which is also very commonly seen in the hospitals. You're going to add up all their fluid intake over 8 hours. Then you're also going to calculate their fluid output over those same 8 hours. You're going to do the math, determine whether they are fluid overloaded or dehydrated, and by how much. And then you're going to tell me what they would need to fix it. Would they need a diuretic or something to act as an anti-diuretic? Lastly, I've given you a different type of example. Yes, that is me in the Ironman many, many years ago. Here we have an athlete exercising over a 14-hour race. That was just about my finishing time. It was actually 13 hours and 45 minutes, but the clock up top, because it was a staggered start, said 14 hours. But that's a nice round number. So now, instead of calculating over 8 hours, you're going to calculate this over 14 hours. And even though this might be a bit of a out there example with the Ironman triathlon, certainly you can imagine someone working outside all day in the summer, an athlete in a game in a hot day. So there's different examples of fluid intake. For me, this is about what I would take in per hour. I would bring in water. It's actually by bottle. That's why I paused for a minute. I had an endurance formula called Accelerate, and then there is some water in the foods that I ate. So you're going to add up the fluid intake, and then you're going to add up the fluid output. Okay, over those same 14 hours. Ways in which an athlete will lose fluid, urine. Honestly, it is pretty common to have some runny stool in those porta potties. Not a pleasant place to be, but you got to get rid of it. A lot through sweat. And you can also lose through exhalation. So even when I breathe out, there's some water droplets in your exhaled air. That is not a pleasant picture of me, but it shows you probably what it feels like on the marathon course there. And then you're going to compare fluid intake to fluid output, see whether they're fluid overloaded or dehydrated, and see what they might need to fix it. Some cool real-life example, folks. Go ahead and enter your data into your lab assignment, and then off you go.